You know, last year I had a nasty little hernia pop up that, no pun intended, and I knew that to get some relief I was going to have to work with some great surgeons, and that's why I came to South Mississippi Surgeons here in Ocean Springs. Dr. Edward Dvorak is one of the surgeons here. Didn't necessarily do mine, Dr. Simpler did, but I mean, that is one of the specialties that you do. Give us a little bit of background about yourself first, if you would, please.
Well, I came to the South Mississippi Surgeons in 2003. I went through the Air Force HPSP program. They paid for medical school. You went to University of Tennessee, Memphis for medical school for 4 years, and then went off and did my active duty. I was a flight surgeon for 4 years up at McConnell Air Force Base, Kansas. And
thank you for your service.
Oh, thank you.
Appreciate that.
And then went back to residency at University Medical Center in Jackson. Did 5 years of general surgery residency, and then started in private practice here with South Mississippi Surgeons in 2003, and I've been here ever since.
Now, we understand that you do a lot of hernias, and there are so many different types of hernias. Is that mainly what you work with, or just
most of my
as
practice is focused on hernia surgery
Yeah.
At this point, and that's what I enjoy doing. And I have a lot of additional experience and training in minimally invasive hernia surgery, so that's what I've chosen to focus my practice on.
Tell us a little bit about the difference in hernias. I mean, you were naming off some of them before we actually started shooting, but inguinal?
Yeah, you know, starting with the more common ones, umbilical hernias, which there are several weak spots in the abdominal wall where people get splits in the muscle, and that's really what a hernia is. It's a hole in the abdominal wall, and the umbilical area is where your umbilical cord went through your abdominal wall when you were developing, and that's a very common place to get a split and a subsequent bulge or a hernia there. The inguinal area is where the testicles move through the abdominal wall during development, and they also leave a space or a communication there frequently, and that's where patients get inguinal hernias. That's probably the second most common hernia that we see around here. But also a really common place to get a hernia is through a previous incision. Patients that have required big open emergent operations where we have to go through the midline to open up and fix whatever's wrong and save their life. When we reclose them, a lot of those patients, areas of the incision can split back open, the muscle can split back open, the skin stays sealed, and that's called an incisional hernia. And those are some of the most problematic to fix. And we've developed a lot of special techniques to fix those to where they don't come back as often as some of the older techniques. And that's probably the latest developments in hernia surgery have been in how we fix some of these larger incisional hernias where, in some cases the entire midline closure is opened up and patients have these huge bulges when they cough.
Now, I had a hernia like 7 years ago that another surgeon over in Biloxi fixed. So he's since passed away, but he did laparoscopically. And then the one that I got last year that Dr. Simpler did was in the same area, but he said it was not actually the same hernia that came back or anything like that, but he had to fix it with an incision this time instead of going in and doing that. Do you have a lot of that happen?
Well,
that you have to go
fortunately
repair?
not. With the minimally invasive technique, really, or the open technique, recurrence rates are very low. And inguinals we probably do better, as surgeons, we probably do better fixing inguinal hernias than any other type of hernia. Our recurrence rates of open or minimally invasive are around 2%. So you have a 98% chance of it being a lifelong repair.
Well, I have not had a problem with mine since y'all fixed it.
It's really uncommon for them to come back a third time.
Yeah.
And that's good news because, like you said, if you have the minimally invasive approach the first time, you have to have the open approach the second time, which is a little bit more of a post-op recovery. Just as good of an operation, but it's more like a week or two off work, just kind of laying around the house rather than with the minimally invasive, especially the robotic approach where the incisions are higher up here.
Right.
3 8mm incisions, most people are back to regular activity within a day or two, and a lot of my patients don't even take any pain medication.
Wow. Yeah, I was out for about a week, and I was someone impressed with the way Dr. Semper sealed it up with the super glue.
Yeah.
That and you can't even tell that there's an incision there.
Well, good. Yeah, the open repair does get your attention a little more, which is why we really only use that if somebody's had a prior minimally invasive repair that's failed, or commonly I'll see an elderly patient who won't withstand the 45 minutes of general anesthetic that it does take. We can do open inguinals under almost local anesthesia. So some of my older patients that are higher risk, I will choose to do those open, but those are few and far between.
What kind of hernia is caused by lifting something too heavy?
Just about, you know, if you're going to get a hernia, you're going to get a hernia. I tell patients, some of my patients will come back after the 6-week limitation point and say, I haven't lifted anything. And I always tell them, you don't have any restrictions at this point. If you're going to get a hernia, you're going to get a hernia.
Right.
And not lifting for the rest of your life, for most of us, is not a realistic idea. So, you know, basically you have these weak areas, and in some cases with the inguinals, you actually have a little tunnel. We'll put laparoscopes in people to take gallbladders and appendices out, and all the time we'll see little asymptomatic hernias down there, little passageways, and we usually come back and fix those electively down the road, because little hernias can incarcerate or strangulate, cause a problem, become an emergent problem, just like big hernias, and little hernias turn into big hernias down the road. You know, people are going to lift and people are going to get hernias because you know, you have weak spots in the abdominal wall, and that's just a fact of your anatomy, and that's why people get them.
Have you been having an issue with people who have hernias that are afraid to get surgery right now because of COVID?
Yeah, that's not just hernias, but you know, we're seeing a lot of cancers that have kind of you know, gotten too far down the road. A lot of patients not getting the proper wound care, not coming to the hospital for a lot of different things, and that's, you know, a problem that we hope we see turn around pretty soon. But yeah, for sure, there's a variety of reasons people don't get their hernias fixed. Some people will read on the internet that small asymptomatic hernias don't need to be fixed, and that's incorrect information.
Yeah.
You know, as we see many times, patients with small hernias will come in through the emergency department.
Become patients with big hernias.
Or they'll come in acutely incarcerated where the bowel gets trapped and produces an obstruction, and those patients get sick very quickly. So.
All right. Dr. Dvorak, thank you so much. Appreciate you and for you know, giving us some information on that. Again, if you need some more information about you know, if you have a hernia situation, I guess they need to see their primary physician to get a referral?
Generally.
Okay.
That's the way that works.
All right. Go to your primary physician, get the referral, and then come to see them here at South Mississippi Surgeons. They're located over in Ocean Springs. I can give you a personal attestament that they do wonderful work, completely satisfied with South Mississippi Surgeons.